Smallpox Virus by Ozer Productions. Beware, smallpox virus is deadly. Classification of the smallpox virus. Smallpox is a virus which cannot be put in any kingdom because viruses don't live when they're not in another organism. Furthermore, there are two forms of smallpox. Variola major is the severe and most common form, with a higher fever. Variola minor is a less common and a much less severe disease, with death rates of 1% or less. Transmission of smallpox. It is most commonly spread by a person-to-person contact, which makes the spread of disease relatively slow, but transmission can occur through inhalation of airborne variola virus, too, as all viruses. Symptoms. The smallpox virus has an incubation period of 10 to 14 days before symptoms appear, which is considered to be small. Smallpox is an unusual virus in that every infection causes apparent symptoms. Symptoms are similar to other viral diseases such as influenza and the common cold fever of at least 38.5 degrees Celsius, muscle pain, and headache. Furthermore, the digestive tract is commonly involved. Nausea and vomiting and backache often occur. By days 12 to 15, the first visible lesions, small red spots called ananthem, appear on mucous membranes of the mouth, tongue, palate, and throat, and temperature falls to near normal. These lesions rapidly enlarge and rupture, releasing large amounts of virus into saliva. Medical treatments. The vaccine for smallpox was the first vaccine ever developed. In fact, the term vaccine comes from the Latin word for cow, vaccinus, since the original smallpox vaccine was made using the cowpox virus. Smallpox vaccination within 3 days of exposure will prevent or significantly lessen the severity of smallpox symptoms in the vast majority of people. Vaccination 4 to 7 days after exposure can offer some protection from disease or may modify the severity of disease. Other than vaccination, treatment of smallpox is primarily supportive, such as wound care, infection control, and flu therapy. Prevention. In 1796, Edward Jenner, a doctor in Berkeley, Gloucestershire, rural England, discovered that immunity to smallpox could be produced by inoculating a person with material from a cowpox lesion. Cowpox is a pox virus in the same family as variola. References. This slideshow includes only one picture of a smallpox virus due to the disgustingness of the virus. This project was made by COP with collaboration of Ozer from 9E.